This is a collection of clips of me teaching Nurse Emily the concepts of how I conduct a meaning of life discussion with patients. Sharing this teaching moment hopefully will give patients some insight into what to expect and how we are structuring this discussion. You can see the full lecture by clicking the link in the description below. Emily wasn't mic'd up, so her voice might be a bit faint. I think the best versions of the meaning of life are if the patient is able to articulate that meaning in response to an open-ended question. So I start with those, and then I do kind of a review of the sources of meaning that I've found. If you won the lottery tomorrow, what would you do with the money? Because having money and health are very similar in that they are freedom-based concepts. The other one that comes up a lot, I think, is transitioning to a family focus. Is, hey, now I'm ready to have kids. Now I'm ready to focus on having a better relationship with my partner. The next way of framing it, if you live a great life, you're finally on your deathbed at 120, right? And you look back at your life, and I was a huge success because I did what? What were the things that when you're looking back, you say I was really successful? I think that's a very valuable framing. The third framing that I haven't found the exact right question for, but even this is probably the most powerful, and when I really dial in the question, it'll be the most direct, is what things would you do even if you knew the path toward doing them involved a large amount of difficulty or suffering? And I think that cuts to the heart of meaning even better than the other questions, because I think in our society, we're given the message that pleasure or happiness is the goal. But obviously, there are things we do that make us unhappy, that are unpleasant, that are difficult. And we actually seek those things out. We seek out challenges. Yeah. And that sort of counters the narrative that all we're after is pleasure or contentment, and cuts toward, no, we really want meaning and fulfillment. Then I think the trick, so to speak, is genuine curiosity and a drive towards specificity. So if I say intimate relationship, then the question is, well, what does that look like? Is that friends? Is that sexual partner? Just a genuine curiosity to flesh out the real specifics until I have a very clear picture in my head as to what that would look like at the very end. My mental structure is we start with meaning, we then get a vision, and then we get targets towards that vision. People will often say, well, I want to gain 5 pounds of muscle in the next year and lose 5% body fat. Well, I mean, that's a very clear vision of what they want in the next year. So great, you jumped a step, but then you have to tie that to a meaning. And so you have to ask, great, that's a cool target. I'll write that down. But why? Why do you care? What's the meaning behind it? And then the targets would be, well, I'm going to work out in this way this many times per week. I think the spreadsheets we've developed are really powerful. I think those will continue to refine in terms of their accuracy, and having that not only in our head but in the patient's head as we keep having these conversations, is there's problems and there's growth, and we're trying to do both. I think that framing is incredibly powerful. Sources of meaning shift, as we talked about. If you talk to that same CEO before he sold his company, he's going to talk about the company. That's the big driver of meaning for him. The impact he's making, the lives he's affecting, the technology he's introducing, whatever it is. Once he sold the company, that is a big shift in era, right? Those are the first three questions. What would you do if you won the lottery, if you didn't have financial constraints? What would make you feel like you'd been a success if you're on your deathbed looking back over your life? And what are the things you're willing to suffer for that you would pursue even if they were difficult? So we've identified 7 or 8 sources of meaning that are pretty common. Progress towards your personal ideal, community, family, intimate relationships. It's interesting how those 3 are so different. They're all relational in some way, but they're very different people in a lot of ways. A self-expression or creative expression, making an impact on the world, collecting beautiful experience, and discovery or exploration. It's very reasonable to say, well, I want an intimate relationship so that I can have a family, right? But it's also very reasonable to say, no, I want an intimate relationship as an end in itself, not for any other purpose. we're trying to flesh out is, at what point does asking why stop making sense in that person's unconscious? That individual may say, well, I want to have an impact on the world so that I'm admired enough to attract a mate, right? And so the impact on the world is actually merely a proxy for intimate relationship. At some point, there isn't a why. It just is because that's who I am. The why is their innate sense of unconscious impulses. And there is no, the question genuinely does not make sense anymore. It makes sense grammatically, but it doesn't make sense to their unconscious motivational set. The really cool thing about the categories is you can see it on their face when you say it. These are sources of meaning that are common to all humans, so everybody wants them to some degree. Everybody to some degree wants growth, some degree wants community, intimacy, family. We all want these things to some degree. But you can absolutely see when someone's like, no, personal growth is a big one. Their whole being changes in the way they talk about it. I think the other big addition recently is not only identifying the sources of meaning, but ranking them and forcing a ranking. One source of meaning leaves you very unidimensional, and people really start struggling with a loss of identity. They feel that they've been subsumed into their role. Two, a little bit leaves you in a dilemma. Is, am I this or this? So I think that people need a minimum of 3 sources. If you're genuinely pursuing 5 sources, you probably can, but you are committing to a very intense workload because it's a lot of hours.